welcome back. Well, last month, Green Bay players Nick Collins and Lane Taylor got a clean shave to participate in Green, Gold, and Growing, a prostate cancer awareness campaign. Well, this month, the men are growing their beards to support the cause. So we got this update from the football players yesterday. As you can see, they're growing their support, and you can too. See, it's coming back.
There it is.
Post your facial hair growth on the Green, Gold, and Growing Facebook page for a chance to win some prizes. And all this is very important since about 1 in 7 men will be diagnosed with prostate cancer during their lifetime. But prostate cancer is very treatable if it's caught early.
Dr. Malika Siker from Froedtert and the Medical College of Wisconsin is here to talk about prostate cancer screenings. She is joined by Harry O'Daniels. He is one of her patients. Great to see both of you. Thank you so much for being here.
Thank you for having us.
It's amazing the statistic that we just read, that Tiff just mentioned. Prostate cancer is even more common than I thought it was.
Yeah.
Prostate cancer is the most common cancer that affects men. As was stated, 1 out of every 7 men will be diagnosed with prostate cancer in their lifetime. But there are cancer disparities within prostate cancer. African American men are twice as likely to die of prostate cancer as compared to non-African American men. Around 30,000 men die of prostate cancer every year.
So you said there the statistic is to die. Is it to also have prostate cancer, or is it that there's not the men aren't getting screened as quickly?
So 1 out of every 7 men in general will be diagnosed with prostate cancer, which results in approximately 30,000 deaths per year in men. And cancer disparities do exist within prostate cancer, as African American men are twice as more likely to die of prostate cancer.
Are there symptoms? I mean, what can people and men look for?
Most cases of prostate cancer, men do not have any symptoms at all. In medical speak, we say asymptomatic.
When did you hear about prostate cancer screenings? When did you become aware of it and maybe the need for it?
When I was seeing my primary care physician over at Froedtert, he asked that I ever had a PSA exam or a test. And I never had considered it, didn't know anything about it. So I agreed to go ahead and have the test, which was a simple blood test. And the PSA levels came back quite elevated. We went further and did a few other tests to detect exactly where the prostate cancer was. So I had not heard about it prior to going to the doctor. And that's one of the things that we should ask our doctors about these things. We should look into and investigate some of the causes, some of the issues that go along. And like Doctor said, there were no symptoms.
So none for you either?
None whatsoever. I was carrying on through everyday life, you know, playing with my grandchildren, loving my family, and when I got this news, it was devastating to get it initially. However, just having a faith in God and having a family support system and doctors and caregivers that genuinely cared for you know, as a patient, made it easy to follow through the process.
So the first time your doctor mentioned to you that you should have the screening was when you found out you actually had prostate cancer,
Absolutely.
Is that correct?
Absolutely. They talked about some of the symptoms that could occur or may be possible, but I had not experienced any of those.
What was the screening like? Because I think a lot of times men are probably nervous to get screenings done.
Well, there are a couple of things that I think with men, we're proud.
Yeah.
You know, we're macho, and we want to be fearless. So we don't want anything to come to us that would cause us to be afraid. And I think that drives men away from getting tested. But the screening was a simple blood test. Just get a blood test, the PSA numbers come back, and then the doctors can look further into it with MRIs or scans and what have you. But I think that, especially with African American men, me being one, and during the process of taking the treatments, I was the only one there. So when I hear these numbers, it really aroused me to get out and say something. Hey guys, if you love your families are going to need you. You really need to do this.
Yeah.
You really need to get tested.
Do you know why, doctor, there's a disparity between African American men and other men?
It's being investigated. I would say that in most cases, we look at the social determinants of health and also access to health care. So it's something that's being investigated actively, but we're very motivated to try to get the word out to improve cancer disparities.
What age should men start getting a test, even that simple blood test?
So men who are, quote, average risk for prostate cancer should consider talking to their doctor about getting prostate cancer screening, which consists of a blood test called a PSA and a physical exam of the prostate starting at age 50.
Okay.
For African American men or men with family history, that conversation should start at the age of 45. And for men with a strong history of prostate cancer in their family, so more than one first-degree relative, meaning sibling, parent, or child, that conversation should start at the age of 40.
Wow. Harry, how are you today?
I'm absolutely fabulous. I have 4 sons, and you know, this is very important to me. And so I will encourage them as they get older. They're not that old yet. But as they get to reach that age, I will definitely encourage them to be tested.
Yeah.
All other men, because it's so important.
Yeah.
And as the doctor said, if it's caught early, it's very treatable, it's curable. And I sit before you, cured and ready to do the next thing.
Oh, well,
Fantastic.
you got a lot more to do in life, I can tell. So
Absolutely.
here's how you can learn more. You can visit this website on your screen. It's froedtert.com/prostate-cancer/prostate for more. So thank you so much for coming and sharing your story and some more information.
Thank you for having us.
Thank you.
Yeah, thanks to both of you.